I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much.
Everyone, welcome to OT Empower Hour. Today, we are going to be doing a diagnoses dive, which is one of my very favorite topics. We do business topics, we do panels, we do diagnoses dives, case studies, but I think diagnoses dives are one of my favorite ones because we really kind of get to pull up our sleeves and learn more about one of the less common, more common diagnoses that our clients will often come and speak with us about as a pelvic floor occupational therapist. So today is all about PCOS, which is known as polycystic ovary syndrome. We're going to get into it. I've got a little bit of a PowerPoint slideshow to share with you, as well as just kind of talking together about this. So bring your questions, bring your comments. OT Empower Hours are all about the community discussion about kind of being the best practitioner we can be and asking all of the questions that we can to get to the bottom of really being able to support our clients. I don't know you're here if you don't put a comment in, and knowing you're here, whether it's live or replay, really jazzes me up. So to make it easy on you, I do some icebreaker questions. And so today's icebreaker question, and just throw it in the comments, is, are you a cat person or a dog person? I'm going to start mine off, and I'm going to cheat a little bit, and I'm going to say both, because most of my life I've been a dog person. But when we moved back from Paris this past summer to the United States, we adopted an 8-year-old cat with diabetes, and it has been an incredible experience for my family, and we just love Dumpling to death. So now I'm officially both a dog and a cat person, but I want to hear from you if you're live and if you're on replay. Are you a cat or a dog person? And because I broke my own rules, you can absolutely say both if that fits you as well. So you may notice my background's a little bit different this week. I am actually visiting my dad in Arizona because I am on my way to the OT Western Regional Symposium. It is a regional conference that Carlin Reum introduced me to. She's based in California in the OTAC region, and all of the states have this regional conference, so it brings together so much energy. And believe it or not, there are 6 pelvic health topics being presented at this conference this weekend. Everything from menstrual topics to sex trafficking to therapeutic yoga. It's going to be insane. So I am thrilled to be a part of this. It's in Las Vegas, and my dad lives about an hour and a half outside of Las Vegas. So we came a few days early because there was 26 inches of snow predicted in Flagstaff. So we decided to get out of town and not risk being able to make it to the conference. So we're here with my dad in Bullhead City, Arizona, and we'll be heading to Vegas this weekend to do the OT Western Regional Symposium. Erica is joining us. Hey, Erica, you're a horse person. I love that. She's all 3. Not sure you can pick one. Love it. We're totally open here on the icebreaker questions in OT Empower Hour. So all good. I love it. Keep them coming in. It really does fuel me. And if you're on replay, it lets me know the topics that you're choosing so I can kind of continue to do content preparation and planning for the next year based on how many views videos are getting. So it really does make a difference when you make a comment. So thank you for doing that. Okay, so today we're going to talk all about PCOS. And hey, Mary, dogs, but you'll always love both. Lexi says 100% dogs. I love that. So I created a PowerPoint presentation today. It's not incredibly long, but it does add a little bit of understanding. And I'm trying to see how I'm able to bring that up here live on Facebook, because of course they've changed everything again on me, which they love to do. If anyone knows how to do that, go ahead and let me know so I can bring that up, because as of right now, I'm not so sure I can do that. So I'm probably just going to jump in with the content, and then I can share my PowerPoint afterwards. Like I said, it just sort of helps to, I'm a visual learner, so I always, when I'm presenting information, I love to be able to show stuff. I know that if I had done this on Zoom, I would have been able to do that. Now I'm regretting that decision. Okay. Enough with the perfectionism. I'm going to just share my content with you, and then we can always add in the presentation later. All right, so here we go. Erica, Mary, Lexi, anyone joining us, let me know. Oops, my screen just changed here. That's what I get for trying to be, to make everything spot on, right? Okay. So anyone else joining us, it looks like we had another comment come in here. Let me know your thoughts on PCOS, what questions you have. Hopefully today my topic will cover it, but if there's anything else in particular, go ahead and throw it in the comments. So polycystic ovary syndrome, or PCOS, is a pretty complex syndrome that has an impact on many facets of our clients' lives. So reproductive, metabolic, and definitely their psychological health. Here's the thing, there's not a whole lot of research about PCOS, and the research that does exist, it's really about how to prevent people with PCOS developing sequela diseases like diabetes or cardiovascular health. Now we're going to get more into that in a minute and why that's a part of it, but the research is lacking on how to prevent it or heal PCOS, but again, more into developing, I guess let's say, more life-threatening diseases such as cardiovascular and diabetes. We don't know a lot about what causes PCOS, but there is definitely a genetic component to it. And the latest research says anywhere from 6 to 21% of people with uteruses are diagnosed with PCOS. There is a greater prevalence seen with people that have more visceral fat. Now let me explain this. This is fat around the organs, not the subcutaneous fat that we can see. So why this is important is because you can also have a lot of people who are lean, who don't have subcutaneous fat and have PCOS, because again, it's more about that visceral component. This is where I wish I had my PowerPoint up, because I'm about to go into the diagnosis criteria from Rotterdam. So Rotterdam actually has a criteria for people to actually be officially diagnosed with PCOS, and you have to have 2 or more of the following characteristics, okay? So they include, you have to have polycystic ovaries, but you can have polycystic ovaries without having the syndrome. Okay, so those can be separate. And then the 2 other criteria, and remember, you have to have 2 out of 3 of these criteria, is something called hyperandrogenism. And that basically means you have a higher level of testosterone and male hormones. And then third is menstrual cycle disruption. So you can have disrupted menstrual cycle, or you could be lacking your periods altogether. Okay, so you have to have 2 of 3 of these things that I just explained to be officially diagnosed with PCOS. Even further, there are different types of PCOS based on this criteria. The rarest type is called ovulatory, and these people have higher levels of testosterone, and but their cycles are actually fine. They have uninterrupted cycles, but they have higher levels of testosterone. They have things like facial hair, which is typically a characteristic of having higher testosterone, and they may have the polycystic ovaries as well. Next up is classic PCOS, which is essentially someone who hasn't gotten their cycles, or their cycles are disrupted. They do have the hyperandrogenism, and they have higher testosterone levels. But then you can have a whole nother category where you don't have higher testosterone at all, but you have all those other attributes. And then the last category is someone who has everything I just mentioned. So there's a lot of subcategories, and this is another reason it can make it tricky to diagnose, because many people with PCOS don't have any symptoms at all. Okay, no symptoms at all. So of the characteristics that we talked about, right, we had the reproductive, we had the metabolic and psychological, right? That's what I want to focus a little bit on, because those are kind of the three areas of a person's life that gets impacted the most, regardless of the rabbit hole of all of the different types of PCOS. So if we go back to that reproductive category of the three categories we're talking about, right, you have menstrual dysfunction, which is related to infertility. Okay, so menstrual disruption and hyperandrogenism, which is that higher level of testosterone, can lead to infertility. And if you actually do get pregnant, you very often have pregnancy complications. Okay, next up is metabolic issues. Now, this is a very interesting one. Many people with PCOS have insulin resistance. So insulin is an incredibly important hormone that regulates blood sugar levels, all right? So for example, we eat carbohydrates, the body breaks it down, our glucose levels increase, and the pancreas, as a result, releases insulin. And the job of insulin is to take that glucose and put it in our cells, right? So think about this as like the key that opens up the cells and puts glucose inside it for energy. And that's essentially the function of insulin. So when someone is insulin resistant, the body doesn't actually recognize that production of insulin that the pancreas is doing. Okay? So therefore, the pancreas is going to produce so much insulin, but the insulin doesn't work as it should, right? It essentially doesn't allow that glucose to go into the cells. So that person is insulin resistant. And what ends up happening is that the high blood glucose keeps building up as someone is eating, because there isn't a hormone to actually regulate those levels, right? And we see this with people who have type 1 and type 2 diabetes. I think I started off today's talk talking about our 8-year-old cat who has diabetes. So I really dove deeply into this before we decided to adopt him. So just tying that back into today's conversation, right? We see people with type 1 and type 2 that have this, and people who have PCOS can have insulin resistance as well. Now, not everybody does, right? Not everybody does, but it can happen. Now, another thing, people with PCOS who have insulin resistance, right, it increases that risk factor of type 2 diabetes, the cardiovascular disease, and a stroke, which is why I think so much research has been put into when someone has PCOS, that high increased risk of getting those diseases, versus just looking into kind of why PCOS happens to begin with. They're focused on some of those bigger diseases. Okay, let's take a quick moment. I want to make sure you're still with me. Erica, Mary, Lexi, put in a yes if you're still with me, because this stuff can get a little bit heady. And when I was trying to decide what to talk about today, I felt like it was really important to talk about this insulin aspect, because it's a really important part of, thank you, Mary. It's a really important part of PCOS. So I also want to make sure that I'm not drowning on without making much sense. Okay, perfect. I'm so glad you're still with us. All right, so let's briefly chat about insulin resistance and how it can increase the PCOS symptoms, which we're going to go into the symptoms in a moment, as far as having higher testosterone levels. So if someone is insulin resistant, they're likely going to have those high blood glucose levels, right? And because that pancreas is producing more and more, but the body doesn't recognize it, thank you, Lexi, you end up having so much insulin in your blood that leads to increases in something called 5-alpha reductase. Oh, hey, Colleen. I'm going to put this in. Thank you for joining us. I'm going to put this in because I'm probably mispronouncing it, which may help you understand it a little bit better if I actually type it. reductase. So it's that. You basically have increased levels of 5-alpha reductase. Sorry, it always sounds so different in my own head. Which is essentially what that is that hormone that gives you that adrenalinous profile, that profile that increases testosterone, right? So that's having increased facial hair, hair loss in places that an increase in hair in places that you don't want it to be, right? And this is increasing testosterone and free testosterone. So people with PCOS, even though not everyone is going to be insulin resistant, increasing that insulin sensitivity is going to be important, because they're going to have a level of reduced insulin sensitivity at some point. So I think part of a goal of working with someone with PCOS, if it's in your wheelhouse, is to helping them work towards that, because at some point that insulin resistance is going to be a factor. All right, so that's that metabolic category. Last category is psychological. Now, all of this has an impact on their mental health, right? It is so common to see people that have PCOS with anxiety, depression, and reduced quality of life, right? So there's so much work there as an OT that we can do that can absolutely impact their quality of life. Sleep hygiene, right? That's so huge for them. Being able to have that level of stress reduction, mindfulness, meditation, right? All of these things that can kind of give them that inner resiliency to be able to cope and go with the ups and downs that often accompanies PCOS. Now, I want to just briefly go through some of the symptoms of people that have PCOS. We mentioned them kind of already, but it's nice to have a concise list, and the PowerPoint deck that I'll upload will show you this. So irregular menstrual cycle, right? Some people have fewer periods, missed periods, or no periods at all. Too much hair on the face, chin, or parts of body where typically a male body has hair. And by the way, this is called, I never say this right. I'm having trouble with my words today, aren't I? Hirsutism, Hirsuitism. I can see it in my mind. And this affects up to 70% of female bodies with PCOS. Acne on the face, chest, and upper back. Thinning hair, male pattern baldness. Weight gain, we're going to get into that in a moment. Weight gain or difficulty losing weight. Skin tags, fatigue, and then for pelvic health, it's pelvic pain, urinary frequency or urgency, pain with bowel movements, and painful intercourse. Okay, so that's kind of the overview of the symptoms. Now, the next thing that comes up a lot as we're thinking about someone with PCOS is, well, is it easy to diagnose? When we see clients, they typically have a diagnosis, not always. And so what was their journey before they came to us? Was it an easy journey? It probably wasn't an easy journey, but I will tell you that the process of getting the diagnoses of PCOS is actually pretty straightforward. And what happens is they check the ovaries first to see if they're polycystic. Then they check their blood glucose. They should be checking fasting insulin and fasting glucose levels, along with something called HbA1c. I hope I have that right. HbA1c, which essentially is an average of blood sugars for the past 12 months. Ultimately, we're shooting for an insulin level under 10, and fasting glucose should be under 90. So that's it. It's very straightforward to diagnose. So remember a moment ago I mentioned that people with PCOS often struggle to lose weight. You might be wondering why, like what's the relationship there? Well, when you have PCOS, there are certain physiological adaptations that take place, okay? First, there's a reduction in our basic metabolic rate, okay? To explain this uber simple, right? It's the amount of calories that we need to stay alive to function, to perform our daily bodily functions, not activity, okay? Not exercise. I'm talking breathing, sleeping, hair growth, immunity, right? And for people with PCOS, this pace of metabolic rate can actually be reduced by up to 40%. 40%, that is huge. This is a big chunk, because our basic metabolic rate makes a big chunk of our daily expenditure, right? So if it's reduced by that much, it often means that our clients are not expanding a lot of energy out, which means to lose weight, they have to eat fewer calories because they're not burning enough. Another really interesting thing is an impairment of appetite control. So when we eat, the body compensates that by regulating our hunger hormones. So when we eat, something called, this is like word bingo for me today. It's CCK for short, but it stands for, I'm putting it in, I hope I'm spelling this right. Cholecystokinin, okay? CCK. It's one of our gut hormones, and it increases to basically tell the body we're full, right? It's like this feedback loop. When we stop eating, we feel satisfied and satiated, right? But because people with PCOS don't produce the amount of CCK that is typical, they may not get that satiated response, so they may overeat. So what happens, right, with this combination of overeating and a base reduction of up to 40% of that metabolic is that it can be really hard to lose weight, okay? So how to improve metabolic flexibility, right? This is how we use the appropriate amount of fuel for the activity that we're doing. So for example, right, you're going to go on a slow walk around the block. That's something we did this morning. It's beautiful here in Bullhead City. The sun is shining. There's no snow on the ground. So my family went for a really nice slow walk this morning, right? Nothing intense. You would expect to use fat as your fuel source because there's nothing intense going on, right? Your heart isn't challenged, your metabolism isn't challenged. But then, right, one of us, probably my 9-year-old, started to speed up, right? He started to jog and then he started to run. This is where his body is going to switch fuel sources. Now it's going to start to include glucose as a fuel source. So now he's burning fat and glucose. People with PCOS have what we call metabolic inflexibility. This means their body doesn't know how to choose between those two fuel sources. So trying to do things that help improve that metabolic flexibility can be really important for their metabolic health, right? So research tells us that carbohydrate bunching is helpful, okay? What is carbohydrate bunching? I'm going to type it in here, it's a weird term. Carbohydrate bunching. It basically means removing carbs for an extended period of time in your day, right? So only carbing in the morning, only carbing at night, and then having no carbs for the rest of the day, right? Why does this help? It basically is in an attempt to improve insulin sensitivity. Okay. Another way they can improve insulin sensitivity is through HIT training, HIT training. Right? So we're trying to improve, remember I mentioned earlier, we want to improve insulin sensitivity even if they don't have insulin resistance yet, because we know that is something that can be coming down the road for them. So these are some great ways to help them with that. Now, one of the questions I get a lot is there a diet? Is there a diet for PCOS? No. Regardless of what you hear from people, there is no single optimal diet. It's very individualized. Different things will work for different people. You're going to see a lot of people try to sell diets for this. There is not a single diet. It is always a client-centered approach. What I will tell you are aspects of some diets that can be really helpful. So the low glycemic index diet has been shown to be helpful in research. Another thing that has been shown to help with certain people is consuming fruit, because this has been shown to reduce the protein oxidation overnight. Okay? Protein oxidation is basically when free radicals form in the body and it leads to cell and tissue damage. And last, high protein diets have been shown to help with weight management and that hunger suppression that we talked about. I usually like to talk about supplements with my clients who have PCOS. And by the way, I'm going to tell you my top recommendations for that, but it's not exclusive to PCOS. I feel like these are good recommendations for all of us. Number one is vitamin D. Vitamin D, I'm here, I am enjoying the sun, out of the snow in Flagstaff, and I feel good. I feel good when I have the right amount of vitamin D. How does vitamin D help someone with PCOS? It reduces insulin resistance, and it increases that sensitivity that we talked about, right? We're always looking for ways to increase their insulin sensitivity. We want about 2,500 to 4,000 IUDs of vitamin D daily. Most Americans do not have that amount. Most of us are vitamin D deficient. The second supplement I love is fish oil, EPA and DHA. We should be eating oily fish at least 2 times a week. It helps to reduce testosterone, which we mentioned they probably have. It also helps with blood pressure. It helps with insulin resistance, immunity. It reduces triglycerides, even reduces LDL cholesterol, right? So we need about 300 to 1,800 milligrams daily, but your dosage depends on whether or not you're actually already consuming that oily fish. So if you're doing the oily fish twice a week, you probably need less supplementation. Last up, lifestyle changes. This is very OT. So what are some of the things we can recommend for our clients with PCOS for lifestyle changes? Resistance training. Resistance training. That's a very important one. Focusing on whole foods that are high in nutrients. If they're smoking, talk to them about smoking cessation. Reducing stress through meditation and mindfulness. Sleep hygiene. Here's why sleep hygiene is so important. Lack of sleep can actually increase that hunger, that impulse to eat, because of hormonal interruption. So sleep hygiene is a very tangible thing that our clients can focus on, especially if they're concerned about this like constant desire to eat. And then lastly, reducing alcohol and hydration, right? Again, things we probably recommend to most of our clients. I just want to check in with you guys. Any questions for those of you joining me? Any things that you have found that have really helped your clients with PCOS? Throw them in the comments. I love hearing from you all. I also lastly just want to share with you some of the medications that some of their healthcare providers might recommend. I had a nice slide of this as well, so forgive me as I kind of go through it now, but again, I'll upload the PowerPoint to this so you can see it visually. Number one is the combination birth control pill, right? So a combination of estrogen and progesterone will decrease that androgen profile, that male hormone profile, and it will help to regulate estrogen. It also helps to lower that risk of endometrial cancer and excess hair growth and acne. Number two is an oral anti-estrogen medication. It's called, I told you today was alphabet soup, cholamine. I'm going to put it in for you. And again, when you see my PowerPoint, it will help you make sense of me butchering these words. This is basically something that is usually given to clients the first part of their cycle. Oh, fantastic. Erica is throwing in castor oil packs. I totally agree. Castor oil packs are fantastic for people with endometriosis. Any cystic ovaries is perfect. So definitely someone who has PCOS. It's spot on. Erica, tell us more about Queen of the Thrones. I have no idea what that is. We'd love to hear more about that. The next one is some of the things that a client can take, again, to help ovulation, because some of our clients are going to be trying to get pregnant with PCOS and might be struggling. So that's where that one comes in. The other one that comes in is letrozole. So this is a breast cancer treatment, but it has actually been shown to stimulate ovaries. Another one is metformin. That one was easier to pronounce, wasn't it? Metformin is basically a medicine that people take with type 2 diabetes, and it helps with insulin resistance. And if you become pregnant using one of the other medicines I mentioned, adding metformin can actually help you ovulate. if you don't become pregnant using one of the other medications. I think I said if you're already pregnant. If you haven't gotten pregnant, metformin can help you with ovulation. Erica says, if there's any mistakes, sorry, she's driving. Hopefully you're being safe. We appreciate you adding to our conversation today. She's a naturopath and she's kind of quirky, but I love her. It's organic and she made a beautiful wrap. And if you don't have it as an outside heating source, it doesn't get messy. Okay. So I'm guessing Erica uses the castor oil, and she uses the Queen of Thrones pack that's made by this naturopath. Perfect. Yes, it's that heating source. So it has been shown that castor oil is activated through heat. So I'm guessing that's that combination there, Erica. Thank you so much. Please correct me if I've misunderstood that when it's a safe time to type. Thank you so much. What else? What are some other medications? Where was I? We mentioned metformin. We mentioned some of the other ones. Let's see. There's another one that's going around in my mind. What was it? Oh, yes. The other one I was thinking about was, and I'm going to type it because I told you today's one of those days. It's called, it's a hormone injection. It's called gonadotropin. Gonadotropins. So this basically is a hormone medication given by injection that, again, will help with pregnancy, with trying to get pregnant. Now, another medication that's often given to reduce that excessive hair growth or acne is, again, the birth control pill. A very long word, which I'm going to put in, spironolactone, spironolactone, which basically blocks the effects of androgen on the skin, right? So, though that's one of that high levels of testosterone profile is what's going to help excessive hair growth and acne form. So this will help block that effect. However, it can cause birth defects. So I think it's really important for our clients to know that as well. What else? I think clients of mine have gotten laser hair removal, and then acne treatments, right? So topical gels and creams, and working with a dermatologist to really help reduce some of that, more embarrassing aspect of PCOS. Awesome. Does anyone have any other thoughts or questions regarding PCOS? And if you're on replay and you've got them, please throw them into the comments because I love having you be a part of this conversation. I will go ahead and upload my PowerPoint presentation. Apologies again that it didn't make it through. It's probably one of the reasons why I didn't spend so much time learning how to pronounce all of the word alphabet soup today, because I was going to rely on the visual reference to each of the medications I was talking about. So I'll make sure to upload that. Thank you so much for being here. I am so excited that I am going to be heading to Vegas for the Western Regional Symposium. I will be uploading lots of pictures on social media. I'm excited to meet some OTs from this very group that I haven't met before. And I am super excited to be presenting with Carlin Riom, who is an OT Pioneer alumni and just a beautifully inspiring person. Her and I will be presenting together on promoting pelvic health and how people in any setting can very simply start to incorporate pelvic health into their settings now without hours of specialized education, without internal exams. They are equipped. OTs are already equipped to do this work through some really simple tools that we already have in our toolbox. So that's what we're going to be talking about this weekend at the Western Regional Symposium. Everybody have a beautiful, beautiful rest of your day, and I cannot wait to see you next time for the next OT Empower a week from today. Have a beautiful rest of your day, everyone.